Hello, this is Kathy again, and I'm the nurse educator for womenshealtheducation.net. As a nurse since 1988 and educator for almost all of my nursing career, I find it empowering to help women to learn about their health and to make knowledgeable decisions based on the information that they have. I've long been interested in women's health care, having started my nursing career at a USC LA County Hospital Labor and Delivery Department. It was a fascinating experience and one where I learned a lot. But throughout the years, I've done a lot of different nursing jobs, and I'm always fascinated by learning something new. I've added obtaining my master's in nursing education to the list, as I want to be able to educate nurses and patients more. And I've also added sexuality educator, getting some training through the Bueller Sex Institute in Irvine, California. And one of the things that I've found is that when healthcare practitioners talk to their patients, they don't really go into too much detail about sexuality, especially women who are going through menopause, going through transitions in their life. We tend to not really talk about it. Some women are embarrassed or don't want to approach their healthcare provider, and others really don't know how to ask the questions that they could be asking. Sexuality can empower you, and it can be seen as the emotional and psychological health of a woman. And this is so important at this time when we're going through changes and you may not feel as desirable as you once were. It's important to keep in mind the positive points and look at it with a new perspective. Some of the things that are occurring in your body as you face menopause can be decreased hormone levels, decreased elasticity of the vagina and your secretions, pain during intercourse, lack of libido, no fantasies, no desire, and one of the more common problems is what's called hypoactive sexual disorder, and it's an absence of sexual desire. You may have dryness, pain, or loss of clitoral sensation. You can be feeling stress over this, and it can cause breaks in your relationship because it's something that not only is sexuality a physical act, but it also helps to create that emotional bond with your partner. Some of the things to remember is that give yourself credit for who you are. Give yourself permission to explore yourself. Be accepting of yourself. Rekindling your relationship. Make time for yourself and your partner. Have your hormones checked. And keep moving. One of the consequences of menopause can be vaginal atrophy. And vaginal atrophy is where you have a thinning, drying, or inflammation of the vaginal walls. It's a chronic and progressive state. And you may have pain or burning during intercourse. You may have spotting after intercourse. You can have shortening and tightening of the vaginal canal and frequent urinary tract infections. All of these kind of add up to creating less sexual desire on top of the hormone issues. So there can be things that you can do about this. Vaginal moisturizers. More sex is actually good for you. Talking to your partner about it, and maybe do some cuddling, some loving without the sex to start with, to kind of start that warm, loving feeling. The other things that you can do is to talk to your healthcare provider, get a foundational exam, and get your hormone levels checked. And possibly hormones might be something that can help you, or some meditative exercise. Anyway, these are all things that you can help yourself through this change. We want you to be empowered, and we want you to enjoy your human sexuality. As we age, it doesn't have to stop, and that bond with your partner is very important. So make sure you talk to your healthcare provider about it. I'd like to thank Carolyn Zomeyer for helping me with this project. She's a nurse practitioner in Fort Lauderdale, and she specializes in bioidentical hormone therapy and women's wellness. And I'd also like to thank Dr. Yvette Lowry, who is a faculty instructor at Capella University. In the future, I'll be uploading more videos and more blog articles, so please keep checking back because there's more education to come. This is just the beginning. And I would also like to say that eventually I'll be doing some mini courses for you, and maybe some webinars. So thank you for visiting the site, and talk to you soon. Thank you.